Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi, Dr. Darrow.
Hello, Nita. You're looking beautiful as ever.
Why, thank you. And how are you today?
I'm feeling beautiful, and I'm living it up, too.
Awesome. Well, we want our listeners to live it up, and the latest book that you wrote really would help people do that who have chronic musculoskeletal pain. So if you call our program right now, during this hour, you'll get Dr. Darrow's latest book for free. It is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. The foreword was written by the fabulous Suzanne Summers. And she wrote a book called A New Way to Age, and you have a whole chapter, I think, in her book.
I do,
That's
yes.
Fabulous. Oh, the phone number. Do you want to give the phone number?
I do. How did you know that? Please give me a call right now. I want to talk to you. 866-870-5752. That's 866-870-5752.
Right here in the studio, you can talk directly to Dr. Darrow. You can get your free book right here, right now. And we have a lot of fun in this hour, and we would like you to participate. 866-870-5752, 866-870-5752. And you don't want to miss out on your free book. Also, you could check the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on video. And would you like to talk to Neil?
Neil, how are you this morning? This is Dr. Marc Darrow. Thank you so much for calling.
Hi, Neil. Are you with us?
Neil, I understand that you have a left wrist problem. Is that correct?
Oh, it's not Neil. It's Leo.
Neil, of course.
Leo, like Leonardo. Leo. Go by.
Oh, Leo.
Now I go by Leo. My name is Leonard. Yes.
Okay, Leonard.
Oh, sorry about that, Leo.
How long has your wrist been hurting you for?
Well, it's happened twice. Both times when I got out of the hospital last year in October, but it wasn't as severe as now. Now, this time, when I got out of the hospital, but right after Mother's Day, around that time, I did fall, but I didn't have fall on my wrist. I fell on my upper forearm and I cut it, but I know that's not the problem. It just, it really swollen up this time. I'm thinking about you with you said you couldn't lift up a pencil when you had your problem.
You know something, Leo? You got to listen to me for 1 second. We cannot understand you. So if you could please speak very slowly, we would appreciate that.
All right, thank you.
You fell on your forearm, and now your wrist is swollen. Is that correct?
Yes, but I don't think that the fall caused that because I had the same problem last year.
And what did your doctor tell you is going on?
Yeah, it's really swollen now. I put some ice on it Thursday night, and it helped a while, but then it's swollen again.
Okay. Did you see a doctor ever about this condition?
Not yet. I went to the pharmacy and he suggested some kind of topical ointment. And I started looking at the side effects. It's to say things like liver damage. And this says, no, I'm not going to take this stuff.
All right.
I'm not going to apply it on my skin.
All right. Well, I don't know what's going on because I can't see it or touch it. And if you've ever listened to my... Leo, you got to listen because we can't understand you. You got to just listen for a second, okay? If it's red, you need to go to the emergency room. It could be infected. I doubt it is because you had a trauma. And it also could be fractured. So if it were me, I would go to a doctor right there and then. All right? So I'm going to tell you other possibilities, but I have to keep you safe I'm not your doctor. I'm just a guy on the radio who you're talking to. And from what you're telling me, if it's swollen, theoretically, it could be an infection or it could be a fracture. And those are the kind of things that you need a doctor for. Do you understand that?
Yes.
Good, good, good. So that being said, now that I've covered my you-know-what, you've probably sprained your ligaments in your wrist that hold the bones together. There's a lot of bones in the wrist and the hand, and it's very easy to sprain them. The way that I got into regenerative medicine, which today we use platelets and stem cells to heal, is I hit the ground with my golf club at about 100 miles an hour instead of hitting the ball. So I hyperextended my wrist backwards, and it also swelled up, and it hurt very badly. And at the time, I didn't know what to do. My doctor buddies at the hospital said I better get a steroid shot, like cortisone, and I didn't want to do that. And then I was at a workshop in Las Vegas on regenerative medicine, which in the old days was called prolotherapy, meaning to proliferate new tissue growth. And there was a section of the workshop on wrist pain. So I sat through that. And then the doctor who was giving the lecture said, let me inject your wrist with sugar water, dextrose, concentrated dextrose. And I said, I don't want my wrist injected. And he said, it's not a big deal. When I inject it, it'll get a little bit stiff. And then by tomorrow, in about 24 hours, the pain should be gone. And that's exactly what happened. The next day, my wrist was about 50% better. I then proceeded to inject my own wrist about 3 or 4 times it took to heal it up. So that's probably what happened to you, because you fell on your forearm and you probably stretched out the ligaments in your wrist. Now, if you want to go to the internet and Google wrist and then look at images, you'll see the anatomy of the wrist, and you'll be able to probably pinpoint where your problem is coming from. Now, I'm going to give out my office number. It's 800-300-9300. I'll repeat it for you, Leo. It's 800-300-9300, and you can call in, and if you want to get an appointment, I'll get you in as soon as you like, okay? And I'll take a look at it for you. We got to make sure, though, that it's not fractured and there's no infection. I doubt infection because you didn't mention breaking of the skin, and no entryway through the skin, the integumentary system, to have bacteria enter and cause an infection. And fracture is a possibility. How old are you?
I'm 80 years old.
Oh, 88? Okay. So 80.
80.
Well, I was giving you a few extra good years.
Can I add one more thing?
You could add as many things as you like, as long as you speak slowly to me.
Okay. The third joint back from my thumb, there's three joints on the thumb. The one closest to my wrist, that's where it's really red.
If it's red, you need to go to a doctor. Okay?
Okay.
And that's urgent care or emergency room.
All right.
And then after they're done with you and they tell you you're fine, they're going to probably do an x-ray. Then I can see you and help you heal it up. I would use probably platelets from your blood unless you wanted stem cells. Also, we do that. And we can heal that up pretty quickly. A lot of times people will come in after an acute injury. Acute means brand new. Chronic means more than 3 months. So we can help the healing by injecting cells from your body and focus them on the area and stimulate the tissue to regrow. Now, a lot of doctors give their patients anti-inflammatory medicines called NSAIDs, non-steroidal anti-inflammatories, and I don't like that because that blocks the inflammation, which is God's way of healing the body. It's the natural healing. The inflammation brings a good blood supply to the area, and with that, the area is sequestered with what are called fibroblasts, which are cells that grow more collagen. And if it's in a joint, they'll grow back the cartilage. If you take anti-inflammatories, it actually blocks that healing inflammatory process, which you don't want to do. And a lot of guys use ice. I'm not big on that because that also blocks the inflammation. I like the inflammation. It doesn't feel good, but the inflammation brings the natural way of healing to the body. I hope that you understand that. You know, the old protocol that you'd hear about, you know, in high school when you go to the training room is RICE, R-I-C-E. That's resting it, icing it, compressing it, and elevating it. And I think that's all backwards. It gets rid of the pain, but, you know, unfortunately, when we injure ourselves, it's painful. And the best way to heal it is let it heal on its own. Okay?
I've been taking Tylenol, not a lot, but maybe one a day.
We don't hear you. You got to slow down.
I've been taking Tylenol for pain once a day.
Okay. Well, Tylenol is not great for an 80-year-old's liver, but you can do it if you want.
All right. Thank you, Dr. Darrow.
Okay. 80 years old to me is very young today. I had a man come in last night. A chiropractor, great friend of mine, Randy Weinzoff, called me at about 6 o'clock yesterday. The office was already closed, and he said, do me a favor. I've got this man who's 90 years old, but he's really like 50, and he's got lateral epicondylitis, which is tennis elbow. And the guy plays a lot of tennis and pickleball and stuff. So I waited for him. He got lost, and I had to call him and track him down and got him finally in the office, and we injected him. So age means nothing anymore. You know, we're in a new era. If you ever read anything by Tony Robbins, the new book, Life Force, you'll see that age really doesn't have much to do with it anymore. People are going to be living much, much longer than they have in the past. You know, 1,000 years ago, people would live till 30, and that was old age. And by the turn of our century in 1900, it was like age 40. And I remember when I was a boy in the 50s and 60s, I thought if you made it till like 60, that was pretty good. But today, I mean, my patients are anywhere from kids to 100-year-old people, and using platelets and stem cells works to heal them just like it does anybody else. The age really doesn't have much to do with it, although you hear doctors say it is, but I'm on the front line. I take care of these people. I do the regenerative medicine on most of them, and it doesn't matter what age you are. Healing takes place when healing takes place. It could be a young person who doesn't heal, and it can be an older person who does heal. So don't get lost in the age of 80. It means nothing anymore. All right? Think young and you'll be young.
Absolutely, and I can't wait to read that book. You've mentioned it before. And speaking of books, when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies, actually. And that number to call
is 866-870-5752. I would love to speak with you. And if you're on a Bluetooth, it's easier for us to hear you if you get off of it first. And if you're driving, obviously it's safer for you to pull off to the side of the road before you call us. But we usually get a lot of callers from the road, don't we?
We do. Well, there's a lot of people on the road. I mean, this is,
it's gorgeous.
Big, beautiful place to drive.
It's California.
That's right. It sure is.
So let me take a little thing here to punish Nita with, okay?
Okay, make it quick so it's...
I know we have callers coming in, but it's so much fun.
Okay.
All right, Nita, what do you call a farm that makes bad jokes?
A farm that makes bad jokes is called a jokey farm.
It is, but what do they grow?
Oh, what do they grow?
Yeah.
They grow jokes on stems.
No, Nita, come on. You're way too smart for that. What do you call a farm that makes bad jokes? Corny.
Oh my gosh. Corn, of course.
Okay,
Wow.
Nita,
Okay.
you get a second chance because
Okay.
I'm being kind to you today.
Oh, but we have Marina in Woodland Hills with a foot injury. Yay! Thank you, Marina, for calling. You're the best. You rescued me.
Marina, Dr. Marc Darrow, how are you today?
I'm good. I'm good. Thank you. The question is actually not for me, for my son who had a foot injury and he fell down pretty badly, had a surgery.
Okay.
And now that they're suggesting this is physical therapy, but now they're suggesting another procedure for the nerve, I guess, to burn the nerves so he can, he's in pain.
Okay.
He's in New York. Not a lot of pain, but, there's that fact when he walks, obviously.
Sure.
So,
well, here's what I'm going to tell you already. If it's nerve pain he's having, then he may want to see a chiropractor who has a laser, a class 4 laser, because that can often heal up the nerves. The other thing is he may have a nerve impingement from the fracture or from the surgery, which theoretically could be hydrodissected by pushing fluid through a little needle around that impingement site so that nerve can heal. Another thing that can be done is have him take B6, 50 milligrams a day. That heals the myelin sheath around the nerves. There's a lot of possibility. B6.
E6.
B, like a B string?
Boy.
Yeah.
B6.
You got it. And if he's in town, if he ever comes to visit you here, I'll be glad to take a look at it. I don't like the burning. Okay, I don't like burning nerves. Okay, that's just me. I'm more of a natural guy. I'd rather do it naturally. And there's a lot of possibilities of what could heal your poor son. I'm sorry he went through that. How old is he?
Yeah, because he's 28 and there was a very bad injury.
Yeah,
where
it
they
sounds
told
like
me
it.
at the surgery, he had 2 surgeries.
Okay.
So they told me at the surgery that they had to really put his foot together.
Yes.
I mean, that was how bad it was.
Okay. Whoa, we got a
Oops, we
disconnection
lost
there.
her. Okay.
Marina, I'm so sorry. Somehow or other, somebody pressed the wrong button and got rid of you. You can call back if you like at 866-870-5752. And if you have questions that we haven't really talked about or you're shy to call the studio, I hope you're not, because I love talking to people. You can always call my office at 800-300-9300. And then there's an alternative also, which is to go to my website, which is loaded with lots of videos of me doing these procedures, and you can watch them and see if it's something that you want to do. Regenerative medicine using your platelets or stem cells is really a simple procedure. And to get stem cells, it takes me, if I do bone marrow, it takes about 15 seconds after I numb up the area. I've done so many thousands of them. It's like I could do it with one hand behind my back blindfolded. I'm kidding. But we have a great team, and I think I've done more than anybody else on the planet. That's what I'm told. I don't know if I'm sure of that.
Might be 23 years plus tax and
Yep.
going.
Yep. But anyway, the website is www.lastemcells.com. And on the website, you can email me if you're shy and you don't want to call in. There's a spot on every single page to email me. I get emails, as Nita knows, all day and all night long from all over the world, and I personally answer every single one of them. So I am running to my computer between patients when I wake up in the morning. I was up till 1 in the morning last night doing that, and I really enjoy communicating with people. I always did, even as a little boy. I used to write a lot of letters. We didn't have the internet back then, but I'd write a lot of letters.
Back in the 1800s?
I think it was earlier. It was a pen that I used to what was
A quill. They called it a quill.
The flume, dipping it in an ink thing. But I actually did that when I was a little guy. I loved doing that, and I would get letters, and I loved going to the mailbox to get my mail. I just loved that. Martina, are you still with us?
She's back.
Are you with us,
Marina,
Martina?
I think.
Marina, I'm sorry.
Marina. Yeah, hi. Yeah, so the question that I have, let's say he comes in and see you for one session, but he's going back to New York. Would that help one session or?
Well, here's what I would say. When he comes in, make him come the first day that he's here. Okay?
Mm-hmm.
Don't wait till the end of his trip. He'll probably be here for a few days, right?
Right.
Okay. So get him in, make an appointment the first day. And if you're having trouble with my staff getting him in because they say that you're busy or we're busy, just email me and I'll get you in with the day and time that you want because it's sort of an urgent situation, okay? Get him in the first day because I may need to see him several days in a row.
Mm-hmm.
Okay?
Okay. Yeah, because he's going to do a lot of walking in New York. He lives in Manhattan, so,
Yeah. Yeah, I hear you.
He needs help.
I hear you.
He will need help.
Yeah.
It's not like
God,
LA.
No. God bless you, and God bless your son. And
Thank you.
hopefully we can help with his nerve pain and any other kind of pain that he's having in his foot and maybe his ankle or his leg. And I hope he never has to get his. I hope he never gets his nerves burned because there's much more conservative things that we can do.
Thank you, Doctor. Yeah. Oh my God.
And you know what? You can have him call me at the office at 800-300-9300 and just tell the staff when they pick up that his mom talked to me on the radio, and they'll grab me and I'll talk to him. Okay?
Thank you.
Or he can email me through the website too, and he'll have his phone number there. I'll just call him up. How about that?
Oh,
have him
go.
Great.
Yeah,
have him go to www.lastemcells.com and send me an email, and I'll call him right up.
Okay.
Sound good?
Okay. Perfect.
Yeah.
Thank you.
All right. God bless you guys.
Michael, by the way.
Michael,
Thank
perfect. I'll be looking for him.
Thank you, Marina, for your call.
Thank you.
Sweet, huh?
Yes.
A good mama.
I know. That's really touching.
There's nothing better than a good mama.
That's right. And our number is
866-870-5752. I'm going to repeat it. Grab your pen. 866-870-5752. And if you miss us at the studio, you can always get me at the office and get more information there at 800-300-9300. I'm right across the freeway from UCLA on Wilshire Boulevard. I went to UCLA for my residency, and I stayed close. I love that place. So, Anita, I'm going to go to a question right now, if you don't mind.
Yeah, I just wanted to make sure everybody knows that when they phone the program right now, they get your latest book for free, which is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. The foreword is written by Suzanne Summers. It's a great educational handbook. I carry it everywhere, and I have them in my car. I give them away.
Wonderful.
And also,
I'm going to take over 1 second here, Anita,
go
if you
ahead.
don't mind, because we're coming up to a break soon.
Okay, go ahead.
And I just want to mention that we do the vampire facelift at our office, which is doing regenerative medicine on the face. It just means we inject with your platelets or your stem cells and regrow the collagen in the face and make you look young very quick. It's not a simple, it's not like fillers necessarily, which go away. This actually regrows the collagen, and it's something that stays. So it sounds very simple, and it is very simple. And we do hair restoration. If you are thinning on top, we can help you regenerate the hair using your platelets or stem cells. And that is a good thing. So, Nita, you were going to say something else, and I cut you off, so go for it.
Oh, that's okay. I just wanted to remind people about the website, www.lastemcells.com. That's lastemcells.com.
And there's that banjo. So I'm going to give you the phone number. We're going to break, but you can call me anytime, including now, at the studio, 866-870-5752. We love our callers. Please call now.
Do. And if you're just tuning in, this is Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.